Welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. I'm your host, Tom Nelson, and I know firsthand as a family caregiver and part of the sandwich generation how tough it can be to take care of your aging parents while balancing your own life, career, and family. We'll bring you the experts and information necessary to help make your life a little bit easier and you a little bit smarter. Synergy Sessions is brought to you by Synergy Home Care, bringing you personalized in-home care and peace of mind to Silicon Valley families. I really do hope you enjoy the show. Hi, everybody. Welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. I'm your host, Tom Nelson, and today we have Vanessa Souza from the Alzheimer's Association with us. Vanessa is the Senior Manager for Community Engagement. The Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support, which is a lot. Thanks so much for being on Synergy Sessions, Vanessa.
Yeah, my pleasure. Thanks, Tom.
Awesome. So why don't we just start out, what is your role in community engagement and also just generally Alzheimer's Association? That was kind of a mouthful I just said, but maybe in general terms, what does the Alzheimer's Association do? Who do they impact? And
Yeah,
their
for
reach?
sure. So my role within the Alzheimer's Association is, it's right there in my title, right? It's community engagement, which means I'm out in the world, meeting people, helping to raise awareness. I work a lot with our care and support team to bring community education out. So literally anywhere in the greater SF Bay Area and beyond. And I also work a lot with our volunteers, especially our volunteer community educators who bring some of that community education out there. And the Alzheimer's Association as an organization, actually, we're spread across a lot of different areas. So we do have that, you mentioned care and support, right? Enhancing quality care and support is one of our priorities. It's part of our mission. And care and support is that area where we provide support groups, care consultation, referral services. We run a free 24/7 helpline that anybody nationwide can call anytime. So that's all that care and support. Another area is research. So we both fund and advocate for the funding of research globally. We also fund research locally. So like even right here in the greater SF Bay Area, we have researchers that are receiving awards or grants from the Alzheimer's Association. Increasing awareness. So something that I learned since being part of the Alzheimer's Association is that some people don't know we exist. And they don't know about it until after they need the support. So growing concern and awareness, making sure that we have a media presence, making sure that we're getting our name and our services out there in the world is another area. And then we work in public policy on the local, state, and federal level. We have separate advocacy arm called the Alzheimer's Impact Movement that folks can join if they want to be a part of advocacy. And then underlying all of that is a strong belief that this sort of care and support and this sort of research progress needs to be in all communities everywhere. So we're really committed to strengthening representation of all types of folks within the Alzheimer's Association, within research, and within that awareness and public policy, right? Alzheimer's disease affects folks across all pillars of humanity. So we want to be there for all of them. And then at the end of that, sort of holding it all up is revenue. So we have development people who are out there and you know something about that, right? About our development area. So our Walk to End Alzheimer's, our Longest Day, and our other constituent fundraising events. So it's a big umbrella. We do a lot of work all across Northern California and Northern Nevada, and then nationally as well.
Okay. Wow. That's a lot. And part of the reason why I'm loving having you on is because I am trying to help, get the word out, create more awareness. It's not supposed to be a best kept secret. And as you know, so I have a pretty personal story around Alzheimer's and dementia with my mom had it for 16 years. My dad had vascular dementia. One of the reasons why I'm in home care is because we had home care for my mom. So I was exposed to just the positive impact of support for the family caregivers. And as you said, now I know about the fundraising aspect because I am now on a walk committee. Thank you for helping me connect with that. Keeping it on a kind of on the higher level on research, what is the focus on Alzheimer's? And because as you mentioned, people are, when they start to think about Alzheimer's, is because it's just impacted them. Their loved one now has it, or someone they know, and now they're just being introduced. So what are maybe some of the developments or some of the things that the Alzheimer's Association has impacted by their support of research and the revenue they're bringing in and moving that forward?
Yeah. So research is, the wonderful thing about research is that there are scientists working
Mhm,
across all sorts of areas in brain health. So there's people
mhm,
working on potential treatments, right? Things that can help folks who are already living with Alzheimer's disease or living with other kinds of dementia. There's
mhm.
folks working on ways to slow progression. There's also folks working on ways to prevent the onset of dementia to begin with.
Yeah,
So these are all different
right.
areas that folks are working in. Things from individual modifiable risk factors, right? Identifying
Mhm,
what those are,
yeah,
to things like medical interventions. So a
mhm,
couple of big things that are going on right now. We now have, for the first time in history, treatments that change the underlying disease course of Alzheimer's disease for some people, right?
mhm,
These are newer medications. Alzheimer's disease was first identified in the early 1900s. And it
wow,
wasn't until these last couple of years that we have a medication that affects the underlying disease for some people, right? But the other thing that's really interesting, and it's been in the news recently, is the FDA approval of a new blood test to be used as part of the diagnostic process.
okay,
That is something that you'll probably be seeing more about in the news soon. It's already out there. So basically it is a way of using a blood test to help as part of the whole profile of diagnosing a person. So it's not as simple as you get a blood test and they tell you, yes, you have Alzheimer's disease, yes, you
yeah,
don't. But it's another piece of that whole diagnostic process. You probably remember from going through it with your mom that it can
mhm,
be an arduous process and it can
mhm,
be really hard for folks to access some of the tools, right? Some of
yeah,
the scans and things like that we've used to diagnose in the past. So this
yeah,
will be another piece in that puzzle. And then the other area that we're learning a lot about is potential lifestyle changes, lifestyle interventions that folks might be able to
mhm,
make on an individual basis. So we don't have the results yet, but in July, there is a study that's been going on for several years, the US Pointer study, which was a large scale longitudinal lifestyle intervention study. They should be reporting out in July. So we should
mhm.
have some information. What the results are, of course, we don't know yet, but whatever they are, we'll have more information about lifestyle than we do right now in this moment.
Right. Wow. Yeah. So that's amazing because like real progress is being made. Because sometimes you don't, money, you just hear we're doing research, but this some milestones around moving things forward as far as early diagnosis as well as interventions to help. So if somebody's listening to this and they're an early diagnosis, if they get engaged and learn about what's available, it could help, I would imagine, slow the progress or maybe help with just like the symptoms of Alzheimer's as well. And then also somebody who maybe has parents who have had Alzheimer's, if they're able to, I know there are other tests to help you kind of get ahead of it, or maybe like you're talking about lifestyle, to maybe help mitigate as much as possible your risk factors. I would imagine that's going to be coming out in that report potentially.
Yeah, I mean, I think we're all hoping to hear good news, get
Mhm.
some more information. I think the most important thing for anybody facing any kind of dementia is
Yeah,
knowledge, right?
right.
Whether that's knowledge for the person with the diagnosis, knowledge
Mhm.
of being able to plan ahead for the future, knowledge
Yeah,
of what treatments might be available for them, but also for those of us with a family history, those of us who
yeah.
are concerned about ourselves, knowledge for what to look out for in terms of changes,
Mhm.
and also for just learning more about how we can take the best care of ourselves we can. One thing I think everyone should do who's over 65 is they should have their cognitive health screening every single year.
Okay.
That is something that we can start encouraging folks to do. We
Hmm.
know that there are changes that are normal parts of aging, and there's changes that
Right.
are not so normal. And so, one of those little knowledge pieces that I think is so important is, how are my memory and thinking doing right now at the age I am
Hmm.
now? And how are they doing
Hmm.
next year and the year after that? And sort of tracking, right, what's going on. So
Right.
that's a piece um, that's accessible to anybody
Hmm.
right now.
That's really interesting. I hadn't heard that. So at 65, just like any other type of test, it's good to
Yeah.
get your benchmark or your baseline and to see if there's changes, because it's probably you and your loved ones, because you're around each other all the time, or you're probably not seeing the changes in yourself. To have that once a year is probably more of a professional is going to say, oh yeah, there is a significant change, or that's great for people to know. Usually, again, people aren't thinking about Alzheimer's until it's affecting them. So all the amazing things that the association is doing right now probably isn't the first thing on people's minds. It's like, okay, my loved one or myself or whoever has this, what's the first step as far as reaching out, and what types of specific resources does the Alzheimer's Association provide for somebody, let's say Silicon Valley here, they're in our community. What's the first thing to do, and what resources specifically can they expect or count on or
Yeah.
explore?
So I would say the very first thing to do, whether you're facing a new diagnosis, whether you're worried about yourself, worried about a friend or a family member, is
Mhm.
either pick up the phone or go online,
Mhm.
call our helpline, 800-272-3900. That is the entry point to all of our programs and services. And the other way is alz.org, our website. So our website's really robust. It's got a pretty good search function. So you could put
Mhm.
in diagnosis and it'll pull up a page that has all sorts of resources about how to get a
Mhm.
diagnosis. You could put in home care and it'll pull
Mhm.
up information about what kinds of home care, things to be thinking about for someone with Alzheimer's
Mhm.
disease. And our helpline agents and our support staff on the helpline can do that same thing. In terms of locally, one of the things that's great is that we can look things up by where you are. So
Mhm.
we can help you find a support group in your area, whether that's in person or virtual, help you find an education program that we're offering, again, in person, virtual, or pre recorded. We have
Oh.
evergreen recorded webinars that live on our website that you can watch
Mhm.
anytime, day or night. But we also have live webinars people can join, or programs out in community centers and in workplaces and things like that. Folks can
Mhm.
access all of that through our helpline.
Got it. Is there a cost associated with this? I know you're bringing in donations and revenue, that type of, but I would imagine if somebody has the ability to pay or not the ability to pay, how does that work? Are there?
Yeah, so our services are free to the public.
Okay.
So for families and individuals who are living with or contemplating the fact that they may be living with Alzheimer's disease, our
Mhm.
care consultations, information referral, our education, support groups, all of that is free to the public. We don't charge for any of that.
Mhm.
Obviously, we accept donations, as you
Yeah.
know, but no,
Right.
the ability or inability to pay does not factor into their
Yeah.
services. The only things that we charge for are, we have some professional certifications and things that folks can pay for. We have fundraisers and things like that that people can participate in, but our services for the general public are all free.
Okay. Wow, that's fantastic, because a lot of the support services for seniors and people aging, there are a lot of private pay, and if you have the resources and the money, you can get care. But many times there's various socioeconomic differences or inability to pay, or sometimes people in this area very house rich and
Yes.
on a very fixed income, and they're not ready to sell or move out of their house or any of those things. So that's a great place to start. That's amazing. So
Yeah.
the family members who are um, involved taking care of their loved one, how can they get involved with the Alzheimer's Association in addition to caring for a loved one? I've learned that the community that is associated with the Alzheimer's Association is just very strong and deep, and people who may have lost a family member with Alzheimer's are still going strong and still engaged. And I know there's that passion that's there. How can people get involved from a participation, volunteer, fundraising? What's the best way for people to get engaged that way?
Yeah, we have a lot of ways to get involved as a volunteer. Actually, I started at the Alzheimer's Association as a volunteer. Started walking to end Alzheimer's in 2009 and started
Wow.
volunteering more actively in 2013.
Mhm.
And so I, you know, have been in almost every volunteer role that we have, actually. I've been in most of them. There's ways to get involved for one day or a
Mhm.
couple of days, like maybe just volunteering on the day of your walk to end Alzheimer's to be a cheerleader
Mhm.
and encourage the people who are walking. But we have a lot of ways to get involved on a more on a deeper level, right? So perhaps being on a
Mhm.
walk committee as you are, getting involved as an advocate is a way a lot of people get started with us.
Mhm.
Folks come to our advocacy day in Sacramento. It's a one-day thing. Show up at the Capitol and talk to your legislator about
Yeah.
you and the person you care for and why it matters, right? So
Wow.
advocacy is a wonderful way to volunteer. We also have volunteer community representatives who go out and do things like drop off flyers or table at events, right? Just kind of be a presence.
Mhm.
Um, our community educators who go out and offer knowledge, right?
Mhm.
Often a lot of my community educators are either former caregivers, former
Mhm.
educators, or both.
Mhm.
Folks who have a personal connection and want to share that as well as just sort of bigger picture knowledge.
Mhm.
Um, and then we have, some sort of at home, behind the scenes volunteer things too. So we have,
Mhm.
if you want to help us write thank you notes, if you want to make
Oh.
reminder phone calls, if you want to,
Mhm.
help us with something simple like that, we'll find something for you to do. And just like everything else, the entry point is our website or our
Yeah.
helpline.
Wow. As somebody who's been with the Alzheimer's Association and also, like you said, in every volunteer role, what do you think the biggest challenge is, with people just starting out, their loved one's been diagnosed with Alzheimer's, they're starting this journey, what are, some of the things that maybe you can give some insights to help them get over a sticking point? Because sometimes it's very hard to get started, even though
Yeah.
they have the information. There it is. Just jump on the website. But you've been around this a little bit. What's some advice you would give someone just starting out this journey?
I would say it's just so overwhelming, and you've experienced this
Mhm.
from both sides, right? Professionally and
Yep.
personally. I've
Yep.
experienced it professionally and personally.
Yep.
You could start anywhere,
Oh.
and the number of options is sometimes overwhelming knowing what to start
Yep.
with.
Yeah.
So picking one thing to do first, right? We're going
Mhm.
to have the appointment, or we're going to join the support group, or
Mhm.
we're going to call the Alzheimer's Association and ask them where if they have any idea of where we should start, because
Yep.
we're in the midst of this and it's really hard for us to tell what's most critical. I think identifying a starting point is really important. I
Mhm.
think the other thing that's really important is having emotional support quickly,
Mhm. Yep.
um, and having that care team. So having actual physical support, because there's
Yeah.
going to be things that one individual caregiver can't manage. So who's the person you're going to call when, say, you have to pick up your kid from school because they're sick, but
Mhm.
you're also caring for your mom? Like, who
Right.
identify that helper and start to practice asking for help from the people around you, because that's really hard.
That's such a great point, because I think that's across the spectrum of the different caregivers, whether it's dementia or Alzheimer's or other forms of caregiving. A lot of times people don't ask for that help until they're hitting the wall. And I say with my own business, you know, if you can just get a little bit of support or care, or just, it doesn't have to be professionally. It could be
Mhm.
friends, neighbors, anyone to kind of, take some of the load off. That will help with the long run, especially with Alzheimer's, as we all know, and dementia in general. It's a progressive thing. It doesn't typically get better, unless it's some type of a temporary form of dementia or confusion or cognitive impairment. But typically it's for the long run. So the sooner you can start putting these pieces in place, support groups, other information, and get informed, it'll help you be a more effective caregiver for sure.
Yeah.
What what things are coming up right now, or maybe annual things that are happening in case somebody's listening to this a year from now, that they can count on and maybe look forward to getting involved in?
Yeah. Well, so obviously I've mentioned the walk a couple of times, but Walk to End
Uh-huh.
Alzheimer's is taking
Yep.
place all over the country in the fall.
Yep.
So here in
Yeah.
Silicon Valley, it's in October, but in other places, they tend to be sometime between September and October.
Mm-hmm.
They happen every year all over the place. Coming up a little bit sooner at the end of July every year is our Alzheimer's Association International Conference.
Mm.
And so when I mentioned that, some studies will be reporting out in July, it's at that conference, right?
Okay.
Um, and that is a meeting of brain health, Alzheimer's, and dementia scientists from all over the world convening. This year they're convening in Toronto, but it's been in San
Mm-hmm.
Diego. It's been, all over different places in Europe. It moves around.
Mm-hmm. Okay.
But what they've made accessible to all of us now for like the last 5 years or so is a virtual option that's open to the community and that's free.
Okay. Wow.
So they call it AAIC for all. And you
Mm-hmm.
can, again, it's on our website, but you can just go ahead and register and they will give you a community focused track. So a
Yeah.
layperson's version
Mm-hmm.
of that information.
Oh, wow. That's great. Yet another free service, which is amazing. So,
Yeah.
to really be able to give people access to the information they need, whether they're just interested in it or if they actually information or resources, tools they need to implement right now to
Yeah.
help their loved one or themselves. Gosh, we've covered a lot. Is there anything that we missed that you'd like to share, or you think might be important for people to know, that are know somebody or caring for somebody with Alzheimer's or dementia?
Yeah, I want to revisit for just a second the idea of asking for help, just because we talked
Yeah.
about it a little bit. And
Yes.
something that I tell people a lot when I'm in the community is when people ask what they can do for you,
Hmm.
have an idea of what they can do. Have
Yeah.
a list, because I think we've all been in the position of having a friend who's in need and saying,
Yeah.
let me know if there's anything I can do.
Yeah.
Right. And we mean it. We really
Yeah.
mean it. And
Right.
we don't know what to do.
Right.
And so our friend doesn't give us direction and we don't ask.
Yeah.
And I
Right.
think on the caregiving side, right, our friend says, let me know. And then maybe
Mhm.
we are afraid to ask or we're resentful that they haven't offered.
Yeah.
And we feel really alone.
Yeah.
And so I would really encourage anyone who's caregiving, whether it's the
Mhm.
first days or the last days of caregiving,
Mhm.
spend some time thinking about what someone actually could take off your hands if it was a
Yeah.
5 minute thing, a half hour, a half a day, a whole day,
Mhm.
right? And have that at the ready because your community wants to support you, but they don't know
Yes.
how.
Right. Well, I think that one of the things too, from the other side of the coin, which would be the friend who's asking, do you need help? Sometimes it's very easy just to say, no, I'm okay. But I
Mhm.
know, for one, providing respite, which in my business, we use that term all the time, but almost nobody knows what it means. Respite is giving that caregiver, that person, a break. So you're going in and you're helping sit with or visiting with or engaging with their loved one with dementia or Alzheimer's.
Mhm.
Wow, that caregiver can go recharge, take care of what they need, just that mental. Even if you're just in the same space with somebody, you're always on the alert,
Mhm.
you know? So just to be able to know they're with some trusted person that they can disconnect and disengage and kind of turn off their brain a little bit, that's huge. So
Mhm.
I'm just trying to think about what are maybe some of the other things that family members or people who are in their orbit that can actually support them, maybe with a meal or things like that. And that might be some advice that I would provide, is maybe have a list to offer. Because sometimes when
Hmm.
people are in the midst of the stress and the intensity of it all, it's hard to come up with something that,
Hmm.
to tell them, oh yeah, why don't you help me on Tuesday at 5 o'clock? And I mean, that's just, but I don't know, what are there any other things that are maybe some common things that people can do that you can share, that they can use to offer up instead of trying to conjure something up themselves?
Yeah. Well, and we do have a list on our website. So if you go
Okay,
and you look,
perfect.
I think it's like 10 ways to help a family facing Alzheimer's disease or something similar to that on our website.
Perfect.
We
Yep.
got all kinds of stuff on our website.
Yeah, yeah, yeah.
But, I think respite is the thing that we think of first, right? Those of
Hmm.
us who are care providers, because
Yep.
that's what people come to us looking for. But it
Yes.
can also be so simple as not necessarily coming into the home and sitting with the person with dementia, but like, what if your dad still loves to golf and
Hmm.
he can't do a full round of golf anymore, but does he
Yep.
have a friend, an old golfing buddy who would take him
Hmm.
to, Top Golf
Yeah.
to do a little bit of recreation, right? That actually is still respite, but
Yeah.
it's also something energizing and sustaining
Yeah.
for the person with the diagnosis.
Right. Yep.
You mentioned a meal. It could also be something like, if I put in a grocery store order, could you just like go swing by and pick up the groceries and drop them off on my porch?
Hmm.
Can you just, I've got to take my dad to a doctor's appointment and I have
Hmm.
to be at work and I have to walk my dog all at the same
Hmm.
time. Can you just like let my dog out?
Yeah.
Right? It can
Yeah.
be these really simple
Yeah.
things.
Right.
Can you just ask me about me? And
Yeah.
maybe not how my dad's doing, but like, could you
Yeah.
ask me like what I'm up to that isn't caregiving?
Right. Yes.
Sometimes just still being recognized as an individual with a full life outside of the
Hmm.
caregiving relationship, right, can
Right.
be really gratifying and important.
Yeah.
So
Yep.
having someone remember to ask about you, any of that, I think can be really helpful.
Right. As you were saying those, it's really kind of breaking that cycle or that rut that sometimes people get into, because you do, as a family caregiver, you shift roles.
Yeah.
You go from becoming a spouse or a son or a daughter to the caregiver, and now you're just doing the things, and you're just, focusing on taking care of them, as opposed to having that relationship, or your relationships are suffering outside. So as you were talking about that, I was thinking about, or offer to take the family caregiver out to lunch, get
Hmm.
them out too, while, and then support them with a person that can come over. We're going to take you out. We're going to give you a break, or we're going to uh, create a situation where you can be more of the daughter or the son, as opposed to the caregiver, and
Right.
kind of shift that back, because that happens and you don't even notice it. It's that it
Hmm.
just happens over time, and pretty soon you're the caregiver, and that's the relationship. So that's great to kind of snap out of that little bit of a rut, and give either them a break, or focus on each individual, as opposed to that caregiving relationship. That's
Hmm.
really smart. Gosh, I'm trying to think if there's anything else, because you just really hit it. I think that the most important thing is getting help, and starting anywhere, as you said, because one thing will lead to another and to another. Sometimes it's just hard just getting started, because you're caught up in the depth of it. And from what I understand, and you probably know way better than me on the statistics, that the people that are the caregivers, if they are the sole caregiver and they're not getting help, they end up in worse shape than the person with dementia and Alzheimer's. And so that's a huge reason to
Yeah.
do that as
Yeah.
well.
The caregivers are at super high risk for becoming ill themselves. For, I think the immediate thought that comes to mind is because of stress, but actually
Yep.
another big factor is when you're caregiving, you deprioritize your own appointments, right? If we have to
Right.
decide who's going to go to the doctor's appointment, it's going to be the person we care for. And
Right.
so people don't necessarily keep up with, like we were talking about screenings, right?
Mhm.
You're going to make sure the person you take care of gets all their screenings and their
Yeah.
annual exams and things like that. But like, are you getting your blood pressure checks? Are you
Right.
getting your, your annual screenings that you're supposed to have, right? For your
Yeah.
benchmarks? Are you eating? Are you
Yeah.
exercising? Are you
Right.
drinking water? Like, are you doing all
Yeah.
these things that you are
Right.
supporting another person in doing?
Yeah.
So there are risks there. And one of the things that is hard for me in my job is when I meet
Mhm.
someone who says, my loved one has passed away.
Mhm.
I wish I knew about you when I was a
Mhm.
caregiver.
Yeah.
That's hard for me to hear because
Yeah.
we've been here, right? We've been here
Yeah.
a long time, but
Right.
we want caregivers to take care of themselves so that they can be around for the person that they care
Yeah.
for, and so that they can be around for the rest of their life, right? That
Yeah.
is going to be there when caregiving is ended. So, yeah.
Wow. Yep. It's so true. And that's a great segue for me to share that we're going to have all of the information to reach the Alzheimer's Association and to get this really valuable information. We'll have this in the show notes and all the different ways you can access the information, as well as get involved with the Alzheimer's Association. I would strongly recommend, as far as if there's a walk nearby you, join a team, start a team, donate, whatever, because in some way I think about this, Alzheimer's affects, just like other very common diseases, some form of dementia or Alzheimer's affects most people in some way. So your contribution and involvement, participation may even be something that's going to improve your own life someday. You don't even know it yet. So thank you so much, Vanessa, for being on today. Really appreciate it. And thanks everybody for joining us on the Synergy Sessions, Aging Smarter in Silicon Valley. I feel smarter already talking to Vanessa about this. So, or also, if you know somebody, please share, the information from the Alzheimer's Association or this podcast or whatever, to get the information in the people's hands, and it'll have a huge impact. Thanks again. And we'll see you next time, everybody. Bye. Thank you for joining us on the Synergy Sessions. We know you have a lot on your plate, so we really appreciate you spending the time with us today. If you found the information in this episode useful, please reach out to the guest or the resources in the show notes. I know they would appreciate it and would love to help. Also, if you have an idea for a future episode, please reach out to us on Instagram or Facebook, or email us and let us know. We'd love to hear from you and provide information that's useful. Lastly, please remember, you don't have to do this alone.